weeks since we've been here. I got an empanada. She got ripped off for Pringles. $3. Yeah, that's about it. So hopefully it'll be fun. Update. I got it wrong. We aren't going to Puerto Plata. That was like one of the stops. We actually are going to Sosua, which I am at right now. The beach is absolutely gorgeous. The sand is super soft. The water is like perfect temperature. So I'm just kind of living my best life right now. So we just finished swimming at the beach. Well, not really finished, but we're hungry. We're at this place called Papa's Jazz Lounge. These two got Wi-Fi, so they're finally connected with society. So yeah. Good morning. It is now day 10 of my study abroad experience. We are officially now beginning our normal routine of classes, which means that my clinical rotations will start on Tuesday, and they happen every Tuesday and Thursday. The way my schedule works is that I have my pre-professional public health classes from Monday through Friday. I have my advanced Spanish classes Monday, Wednesday, Friday, and then I have my clinical rotations on Tuesday and Thursday. So the Spanish and the clinic visits kind of take turns. I'm excited to get into the swing of things. Toward the end of orientation week last week, it kind of got annoying to have to go to all these like different trainings, which are definitely really important, but it just became training after training after training, and I'm very excited to actually like dive into the material. Yeah. Got out of my public health class. I cannot emphasize just how amazing Professora Michelle is. She's just so energetic, she's so wise, and has just this passion for public health that is so contagious. And just to like put things into perspective, public health is not necessarily one of those subjects that completely captures my attention. But literally every time like I know that I'm about to like go into her class, and even throughout the 3 hours of class, like I get so excited to just hear what she has to say and to interact in conversation with her. And like when the 3 hours ended, I was like, wow, class is already over. She's just so cool, and today's topic was super interesting too. She basically broke down the Dominican Republic healthcare system. And it's on 3 levels. I had talked about this in my week 1 vlog, but it was really cool just to like see it, so I guess raw. So we have the first, secondary, and tertiary level. And like I had said before, when you're supposed to go to these primary clinics that are available in every single community. And if your primary care looks at you and examines you and says, hey, look, this is a little bit out of our hands, we'll refer you to the secondary clinics. And then if the secondary clinics, see you and they can't do it, then we'll refer you to tertiary. And so it's meant the system is created in such a way where the primary care clinics should be able to alleviate most of the issues that the community faces, since they can resolve a lot of the rudimentary and frequent diseases that the community encounters, whereas the tertiary should be filled with physicians that are specialists, right? The problem is, first of all, this whole public healthcare system is theoretically supposed to be free, and for the most part it is. It's funded by the government. However, because the Dominican Republic only allocates 1% of its GDP to its healthcare system, obviously there's going to be limited resources. And so for that reason, there are times where, even though this is meant to be free, any patient that comes in, whatever service they receive, they should not have to pay for it. There are times where they do have a smaller copay. Granted, it is much, much cheaper than if one were to go to the private sector, but it is still kind of unfortunate that it isn't able to match up what it's supposed to be in theory. And so this creates a lot of issues, right? Because in the Dominican Republic, we have patients and just community members that have this incorrect perception and bad perception of these primary and secondary clinics. And then their mindset, it's kind of like, well, why would I bother to go to the primary and secondary clinics when I know that the tertiary clinics can for sure fix my problems? And so instead of going through the linear hierarchy of, hi, let's go to the primary clinic, see if this is just a basic fever or basic cold that I can, get medicine for or whatnot, or is this something more serious that I need to see a specialist for? They'll just jump right to the third level. And this creates a lot of issues because it overburdens these doctors and hospitals in the third level that there aren't that many, first of all. And so this causes I'm thinking about this all in Spanish, and I'm trying to translate in English, and it's kind of hard for me. It creates this uneven and unequal distribution of resources. And so these tertiary hospitals are overburdened, and these primary and secondary clinics are not caring for the patients that they have every right to be caring for. What's more is that the continuity of patient information is not as streamlined as the system would hope for. So a lot of times when you go to these tertiary hospitals, they are filled with medical residents that are trying to specialize. And for that reason, the doctors within these tertiary hospitals are going to change and rotate quite rapidly. And so when these patients go to these tertiary hospitals, they're not seeing the same doctor every time, and their information and their history is not getting properly recorded, and it doesn't ever get passed down to the primary clinic. So all these primary clinics have patients that they should be caring for, but they literally have no idea that they even exist because they just never visit them. And then there's a whole bunch of other smaller issues, such as access to primary clinics can be limited because they close early. They close around 4 p.m. And if you're working a 9-to-5 schedule, then it makes sense how you would want to jump to the second and third level, right? So it was super cool just to see that dynamic and kind of compare it in my mind to the U.S. and how just healthcare is very, very different, and how I don't know. I realize now that I have so much to learn about just healthcare practices in general. I barely know anything about that of the United States. But seeing how it should have worked in theory versus how it works in reality is just super fascinating. So very stoked for this class, very excited to go back tomorrow and see what else there is to learn.
So I just got out of my Spanish class. Last week we had read this article about just health in the Dominican Republic, and it was more of a general article that kind of summarized everything. So it went into the demographics, the different issues that are plaguing the community, a little bit into how the healthcare system is financed, and I learned today that we have to write an essay that kind of re-summarizes those ideas and kind of makes it a little bit more digestible for readers that are just trying to see a quick summary. So I think the objective here is to honestly just become acquainted with the vocabulary, the way in which you talk about public health, the grammar, the vocabulary, and all that. So that'll be fun to write. Oh, another thing that was interesting is that we kept asking her how many pages she would want this to be, want that to be. And then she was telling us, she was saying like, oh, I don't know why you guys are so focused on, the quantity of the essay. For me, what matters is the quality. If it's too little to where you don't coherently express your ideas, that's not good. But at the same time, if you keep blabbing on about the topic and it also ends up not being coherent, then that's not great either. And she just was saying like, I don't care how many pages it takes you, but I want an essay that completes the objective. And I really like that kind of perspective, because I know, at least with my professors at Berkeley, that it's always like minimum 5 pages, double space, stuff like that. So it really felt very IB to care about learning for the sake of learning, and achieving the objective and learning goals rather than trying to meet some grade and some, I don't know, very superficial requirement. Yeah.
Good morning. I am walking on the street because there are no sidewalks. Sometimes sidewalks decide to just end out of nowhere, so pedestrians walk on the street. It is day 11, I think. Today is Tuesday, which marks the beginning of my clinical visits, which I'm very excited for. I am on my way to my pre-professional public health class, go back for lunch, and then we head out to go do the rotations. So, very excited. As you can tell by my shininess, it was very, very hot. I am sweating throughout these scrubs, but it's really cool. And I have encountered a lot of chaos in this program, a lot of disorder, a lot of disorganization in general, but I don't know. We went there, our doctor, Dr. Antonio Esteves, I think that's his name. He was telling us to divide into groups based on themes that we are interested in, because what we're doing is a community project in which we select a theme. So for example, my group is comprised of me and another girl named Priyanka. And we chose to look at the health of very small children from ages 4 and under, especially in terms of the vaccinations. And so what we kind of did today, as you can sort of see in the clips, is that we went around the neighborhood, and these are in barrios that are just they're just there. It is not the fanciest, nicest things, but the people there are just so welcoming. They're so willing to talk and to share with us their medical history. And so we got to see a whole bunch of cute little babies, and try to hopefully find some case studies, essentially, that we will be following the next 4 weeks while we're here. And while we're here, we're supposed to essentially make a survey of various ideas and themes that we want to investigate. So for example, in the United States, vaccinations, or at least the idea behind vaccination is a generally common knowledge, but in towns like these where that type of education is not as widespread, it might not be the same thing. And so our job is to kind of go out there, see what they know, see what they don't know, and see what resources we can provide them. Let them know that, hey, you know, your child actually needs these vaccinations, and there's this free clinic on the corner right here that you could go to, and it's super easy. And kind of just being promoters and facilitators of health and health education, which I think is super, super cool and is also a very fundamental aspect of just medicine in general. You know, education and spreading awareness of what humans need in order to be healthy. I think it's super awesome that we're taking on this project. So I'm really thrilled to see what we're gonna do and what kind of impact we can have on this community. Update on life. I've been doing a really bad job at recording everything. I'm sorry. We had a public health class again today. We talked about social determinants of health, and that was a lesson and lecture that I was very excited to learn about. So really glad we talked about that. We went to the Sandro Leon Museo. I think that was the name of it. And I just kind of wish we spent a little bit more time, just because we literally only spent about an hour and we kind of got rushed through all the exhibits, and it was really cool to just see the dynamic background behind the Dominican Republic culture, how it's a mix of the Taino people, the African Americans, as well as the Hispaniolas. So that was super cool. And then it's raining super hard. There's no electricity, which means that there's no fan, so I'm actually feeling the heat. But good thing my mom packed me a freaking lantern, because she was like, what if there's an outage? And she was right, so thank you, Mom.
Looking at day 13. Oh my gosh. I don't know. Day, whatever you see before this video. Today is a Thursday, which means again I have my public health class and my second day of the clinical visit. And that's actually about it. It's supposed to rain in the afternoon. Hopefully it doesn't cause the electricity to go out, but this time I will come well prepared with an umbrella and poncho. Yes. Showering and everything. The clinical visit was a little bit different than it normally is. The doctors that do work at the clinic were sick, and so they just completely closed today. And so we moved to the other hospital that's on the second level on that hierarchical tier. And then the Dr. Esteves was kind of teaching us about the various transmittable diseases, some of the more epidemic issues, and illnesses that the country faces, as well as just basic knowledge and kind of terminology, especially in Spanish, that we need to know, because obviously AIDS, it's not the same way you say it in Spanish, right? He dropped me and Priyanka off at this vaccination area of the hospital because we're in charge, where our theme is looking at healthy kids, especially in terms of vaccinations. And so we got to see the medic in there do vaccinations for the little kids, and I got to administer an oral vaccination, which means that I got to like open the little baby's mouth and put in some drops of, I think it was sarampion, which is measles, mumps, rubella. I think that was, I don't know what I vaccinated her against, but it was really cool that she like trusted me to do that. And I don't know, it's just, I held so much power in putting those 3 drops in. Unfortunately, I didn't get any footage of that, just because I wanted to like, I knew I'd have to ask for the consent of the patients, and I didn't want to like lose this opportunity just because I was trying to do that and be extra. So, but next time if I get the opportunity, I'll try to record it. So yeah. Jay decided she does not want to be in it. We are heading out. So like I was saying before, there are the healthcare system in the Dominican Republic is divided between 2 sectors, the public and the private sector. And so we're going to make visits to both of those today, compare them, kind of just like be able to visually see the differences. So that's what we're up to today. And then I have my normal Spanish classes after that.